Good afternoon, everybody, and thanks for joining us here for another edition of our virtual health series for families. I'm Sara Arboleta over at Valley Children's Hospital, and we are talking about something that has been dominating headlines, social media, mommy blog groups, and that's the formula shortage. So I am joined by a very esteemed panel of experts here to get your questions answered, and most importantly, to help ease your fears as you and your family are navigating this formula shortage. We are joined by Dr. Hailey Nelson, Complex Care Pediatrician. Dr. Nelson, thanks for joining us today.
Yeah, thanks for having me.
And we also have Dr. Shaban, Pediatric Gastroenterologist. Dr. Shaban, thanks for taking your time too.
Thank you for having me.
Our first GI doctor who's ever joined us for Facebook Live. So thank you for that. And then we also have registered dietitian Sara Rima here. Sara, thank you.
Thanks for having me on.
Okay, so obviously, again, we cannot understate how important this topic is and how it has been so extensively covered in the media. We are talking about a nationwide shortage of infant formula, but this formula is also used by older kids and adults too. And so I want to start off first with kind of a state of the union. And let's start with you, Dr. Shaban, from your gastroenterology lens here. What a lot of people don't know is that Valley Children's and our supply chain team have been dealing with trying to source formula for about 5 months now. Since the new year, there have been some supply chain issues, and our team has been able to meet the needs so far. But this is not new to us, Dr. Shaban, but it does seem to be more pronounced with one of the biggest manufacturers having to take one of their plants offline. So talk to us about that first.
Yeah, so the reason we got into this situation was Abbott, who makes a lot of these famous formulas, surprisingly has about 40 to 50% market share in formula generation in the United States. And they did this formula recall on a voluntary basis due to the presence of this bacteria, Coronabacter zizeki, which 4 infants, and unfortunately 2 of them passed away from this infection. So the FDA decided to close the plant down and do further testing on the plant. And as of this morning, the letter from the company states that they did not find any contamination of the bacteria that was the culprit in the formulas of the babies that that had unfortunately suffered from the disease. And they did find it in some of the bottles that were at home, the open bottles, none of the unopened bottles that the babies had. So I think it's important to stress that this is a voluntary recall for the company, and that the formula has not been linked to those particular babies that were sick or passed away.
Okay, so I know that in the news the other day, they had said the FDA was working with Abbott to get the plant back online, but it would still be a few weeks away. Dr. Nelson, you are in primary care. You deal with children with complex needs in our Charlie Mitchell Children's Center. What kinds of questions have you been getting from parents, especially over the last few weeks about this?
Yeah, so initially with the voluntary recall, we were having difficulty filling some of the requests for special needs formulas, and that's where our dietitians have really been helpful in identifying for those children who do need a specialty product, what a substitute would be. So as a doctor, I've been writing contingency plans for the last few weeks that I really want to not have any interruptions and being able to provide nutrition to children. So if they're not able to get the first line option that we wanted for them, what a substitute is. And now, unfortunately, with the way things are going on the shelves, families aren't even able to find kind of the over-the-counter products. And so that's where we're, here to answer those questions for, okay, well, now what do I substitute for when you can't find just the standard, Similac and Enfamil at your local grocery store?
So we do have kind of 2 different tracks here that we need to cover, because one is the problem with finding any kind of formula. And then the second one is for the kids who have special dietary needs. Both my children were lactose intolerant, had all kinds of GI issues when they were little. And so at the time, my kids had to be on Nutramigen. And right now, Nutramigen and Alimentum are the two big names for kids who need this. And so I do want to start with that, because there are a lot more options for babies who don't have issues that require special formula. So Sara, let's start first with the kids like when mine were little who needed the Nutramigen because of XYZ condition. So Sara, what kind of advice do you have for those families who need special, I think you call them metabolic formulas?
There are hydrolyzed formulas. Yeah.
Okay.
So they're for children who either maybe they're having some GI issues. Most of the time we see it is if there is a cow's milk protein allergy. And these are formulas that are sold in stores. So the Alimentum and the Nutramigen. And a lot of families don't realize that there are actually store brand versions of those as well. Walgreens has their own store brand. CVS has their own store brand. I'm blanking on the other ones. We have a whole list that's going to go out. But these are hypoallergenic formulas that are appropriate for babies who have cow's milk protein allergies. I would still, whoever prescribed that formula to your baby, I still would consult with them just to be safe.
Yeah, because that's the issue, because you're seeing on social media, people are like, well, if I change a location on Amazon to Canada, I'm able to get formula. Like they're trying all these different things, but to your point, Sara, you're saying that there are even these specialty formulas that are still out there. You might have to look a little harder, and it might not be the name brand then.
Yes, exactly. There are certain companies that are making generic versions, and they will actually list most cans of formula when it's a hypoallergenic will list a statement that says basically similar to Nutramigen or similar to Alimentum.
Mm-hmm. Okay, no, that's a good note. It's like when you buy over the counter Advil, you'll get the generic ibuprofen. It says
exactly
similar to Advil, whatever it is. So look for that. So we are, for those of you who are tuning in on Facebook, we are taking your questions. Feel free to put them in the comments, or you can direct message. Our PR team is behind the scenes feeding us questions. But we did start soliciting questions last week. So we're going to go down the order here. The one of the top questions we're getting is, can I make homemade formula? I don't know who wants to take this one first. Let's start with you, Dr. Nelson, just because you happen to be my line of sight right now. But that is a question. If I can't find it in the store, can I just make it at home?
The answer to this really is no. When you are trying to make your own formula, you can't recreate the situation that happens in a factory. So the manufacturers have a sterile environment, and we have concerns about contamination. Thankfully, with that voluntary recall, we just heard from Dr. Shaban that those infants didn't get sick from the formula itself, but that would be something as a parent, you would never want to introduce something to your baby that you could make them sick. And then the other piece is we really can't match the nutritive value that you can either find in formula or breast milk. So sticking with finding something, and that's where we're really here to help families find a can of formula and reading those labels so you know which ones you can swap out for if you can't find the one that you're used to. But please don't try to make this at home, because you can make your baby pretty sick by attempting to mix your own type of formula.
Dr. Shaban, thank you, Dr. Nelson. I love social media, admittedly, but it also drives me crazy too, because you are seeing these people who are sharing recipes for online formulas. Talk to us a bit more, Dr. Shaban, about what Dr. Nelson said about the long-term effects of not using actual formulated formula. That sounded terrible, but actual formulations, and what that can do to a child's digestive system and overall health. Okay.
Well, I don't anticipate this problem being a long-term problem. I think, over the next couple of weeks, the factory will be back online, and by the time formula production starts, it will be probably around 8 weeks until we start seeing a good number of containers back on our shelves. So I don't anticipate this being a long-term problem. In the short term, I think it's important to highlight that babies at different ages, like for example, a preterm baby or a baby that's a term baby, or like a 6-month-old, they have different requirements, and that is really hard to match in a home setting. Different protein requirements, different carbohydrate. There are certain other micronutrients like zinc, iron, and so on that are in these particular special formulas that it will be really hard to match in a home setting. And like Dr. Nelson said, the contamination is a big problem. Making these formulas, storing them in the right temperature, and so on would be, it actually may cause the baby to get sick from something other than the nutrition.
No, thank you for that. Sara, when you are educating families, I know you've heard this. We've got moms and dads in crisis who are super worried and trying to maybe prepare for worst case scenario. And someone asked, several people asked, is it okay to add more water in the formula?
That is a question that's definitely been circulating that we've been seeing. And the question is no, we don't want to be diluting formula at all. Kind of jumping off of what Dr. Shaban and Dr. Nelson were talking about, the effects of a baby not receiving the nutrients that they need. When we dilute formula, we're dealing with electrolyte imbalances. We are dealing with potential for anemia. We're dealing with the potential for seizures. There's a lot of really severe risk that come even in short-term dilution of formula. So we really want to avoid that.
Okay, another question. Oh, sorry.
Hey, Sarah, I'm going to chime in on this one too for the water, because it's really interesting. So as a pediatrician, when we look at babies' kidneys, that up until 6 months, that infants can't actually handle that free water. So that's why we can't add water to your formula, besides throwing off the nutrition, that they physically are unable to process it. So if you have an older baby and they're thirsty, so when we're talking about those 10-month-olds that, you know, in between bottles, they can have sips of water. We actually want you to introduce that later on, but it's the little ones who the free water is actually dangerous to them because of their immature kidneys.
Okay, which speaks to Dr. Shaban's point that the nutritional needs and the way a body processes what you give your child changes in different stages of infancy. That leads to the next question here, and this is, again, whoever wants to answer, just take it. Can you switch formulas? I think I know what your answer is going to be, but can you give a full-term baby premature formula? Can you give a baby toddler formula, vice versa? Can you switch around, or should you really stick to those age brackets?
I think ideally you should definitely try and stick with those age brackets. I understand right now we are so short on so many different formulas. So yes, ideally try and stick, but in dire situations, I would rather see you using a preterm formula for your term baby or a toddler formula for, you know, maybe your 6 or 7, 8-month-old baby, rather than using the other alternatives like a homemade formula or a cow's milk formula or cow's milk in general. But ideally, yes, try and stick with your child's age group and needs if you can.
Okay, doctors, anything to add to that? Or sounds like Sara got it. So
Sara got it.
It's interesting you mentioned cow's milk, because here's another thing that I'm telling you, I should just log off when I can, but part of my job is monitoring social media, so I can't. But the other thing going around is, hey, I've got goats. Let me milk them and give your baby goat milk. I mean, I see all of you going, no. But again, desperate times sometimes call for desperate measures. We keep telling parents, please don't panic. But it's hard when you know, the frenzy is being fed by all these different groups. So talk to us about regular milk, whether that's cow's milk, almond milk, goat's milk. What are the guidelines around that?
So this is the thing that's kind of up for debate right now, because the ideal situation for your infant is that they are either receiving breast milk or formula up through their first birthday. When we hit this dire situation, now we're looking at, okay, what else can we do? And so we are saying, if you can't find anything, well, then you could temporarily give cow's milk to an older infant while supplementing them with vitamins containing iron so they don't become anemic. But we really want that to be your very last thing that you go to while you're trying to locate that can of formula.
Yeah, so Dr. Shaban, as Dr. Nelson mentioned, in a dire situation, you have no other alternative. Cow's milk can be given, but why is it important to make sure that your pediatrician is part of that loop before you do that? What are some of the problems that might arise if all of a sudden you've got your 7-month-old and you're feeding your 7-month-old just cow's milk?
Well, cow milk, it's made for baby cattle, not for baby humans. And so the digestive system in a baby is very sensitive, the younger they are. Yes, around 1 year of age, we do transition them to regular cow milk, but that's for growth, their fat requirements, their brain development, and so on. So we do get a lot of benefits from cow's milk. Just to talk about the point about the goat's milk is notoriously deficient in folate and B12, and parents or people who are on goat milk who are not even babies, they can develop B12 or folate deficiency and anemias. It also has a higher protein content than regular cow's milk, so the baby's kidney may not be able to handle all that. But I would say the AAP has recently decreased their recommendation to about 6 months for allowing cow's milk in order to discourage the use of homemade formulas and home recipes and so on. So I would say if you are debating whether to do a homemade formula or to give cow's milk, I would favor the cow's milk. we're not expecting this to be a long-term problem going forward. It seems like the problem will have a good outcome in the next coming months.
And Sara, let's talk a bit more about cow's milk, because we were even talking about this internally before we started this Facebook Live. Again, as Dr. Shaban mentioned, this is super temporary. But tell us, if a family does find themselves in a dire situation and has to give cow's milk, what are some of the things that they need to do? Because I know you're only supposed to give it for a certain amount for a short period of time.
Yeah, so the AAP did come out and say 6 months in a very dire situation. And I believe that was because most 6 month olds have begun taking in solids. What we're recommending is actually as closer to 10 to 12 months if your baby's in that range, but they need to be taking a variety of solids. So fruits and vegetables, iron-rich proteins, even yogurts and cheeses. So they really need to be more on that older end, and they should still be receiving a iron supplement, a multivitamin. So polybisol with iron would be a great option for them.
The other danger with cow's milk or goat milk, I got a message from Dr. Sosa. Carmela Sosa is our medical director of primary care. She's like, remind people there is also the danger of non-pasteurized milk products. Dr. Nelson or Dr. Shaban, can you talk about, it could make adults sick. So can you talk about what the potential health problems could arise if you feed your child? We already said about the potential problems with goat's milk and cow's milk to an infant, but unpasteurized on top of that.
In a younger child, like around a 6-month-old, their immune system is just getting started. And so having unpasteurized milk would expose them to other contaminants in the environment or other infections. So I would favor pasteurized milk. Okay.
All right. Yeah. It's one of those things where it's like, again, oh my gosh, people don't do this. But I also have 2 children who are no longer on formula. It's much easier for me to say, oh, it's okay, you'll get through it. Dr. Nelson, you've done some interviews with the media, many in the last week, and you did have a message to families trying to tell them to, obviously new moms and dads especially might be more prone to panicking and worrying, but you were telling people, and you're telling your own patients, try not to worry, try not to panic,
Sure. Certainly, this is stressful, and being a new parent in general is stressful. And I think that for all the dangers of stuff that we might find on social media, being able to connect virtually with your village, finding a friend who can be on the lookout for you when they go to the store, because gas is expensive and families are driving around and going to multiple stores trying to find that can. So if you can have anyone else help you in that journey. I've seen lots of posts where, hey, I'm at Costco right now. There's a limit of 2 and I only need 1. Who else wants it? And so I think we can work together to be able to support families who are going through this right now. Because if there are limits on cans, the other problem is you get that 1 can and now you're doing that mental math of how long is this can going to last? When do I have to start going to the store again to find the next can? And so we're really kind of caught in that cycle for some of these families while we wait for it to improve, which thankfully, as Dr. Shaban was saying, is going to be temporary.
I love what you just said. So how about all of you who are watching right now on Facebook, instead of posting these theories and homemade recipes, why don't you post, hey, I'm at Target and I see 3 cans of Nutramigen here. Can I pick some, a can up for somebody? That is great. So Dr. Shaban, we're getting a lot of questions from people who are saying, okay, special formulas aside, just regular formula. You have to switch. And when you're a parent, you like what you like. My baby only had Pampers, never Huggies or whatever it might be. So if you do have to switch brands, again, this is not for like Alimentum or Nutramigen, just regular brands. How can you tell if your child is maybe having problems adjusting to the new one? And when is it a good time to call you or call your pediatrician?
I would suggest that these brands are they are nutritionally similar in composition to the brand names, and so we should not expect significant differences. And like your example with with the Advil and ibuprofen, it's kind of the same thing. It's just that they have different labels on them. Those are for the normal infant formulas. The more specialized formulas, or in general, the message I'd like to relay to parents is that the formula is your baby's nutrition. It is just like a prescribed medication, and when a medication is in shortage, we wouldn't resort to methods where we're making our own medicines at home and so on. So, but back to your question about the type of formula, I would suggest that the store brands are probably going to be really, really similar to the name brand. And if the baby, let's say, is developing a milk protein allergy and would not need to go to a more advanced formula, then we would consider other options for the baby at that point. And it's in a case, I can't say generalized, but more on a case-by-case basis.
Okay. A question that just came in, I'd love you to answer, Sara. One parent is saying, can parents give other liquids in a bottle, Pedialyte, juice, anything like that to their infants?
Yeah, so definitely not juice. We're just going to take that one off the table. I know there are some situations where you and your pediatrician might find a use for that. Definitely go based off of what your pediatrician is advising for that. Pedialyte can be given, but Pedialyte is more for kiddos who maybe are having a stomach bug, or they're not really able to tolerate their formula right now. It doesn't provide a complete nutrition like formula would. And so that should be a very, very, very short-term use. And again, something that you talk with your pediatrician or your primary care provider about.
Okay. Dr. Nelson, another question came in. At what age can parents introduce solids? There's been a lot of chatter about, should we start introducing solids sooner in light of this formula, as Dr. Shaban said, short term, but in light of the shortage right now?
Yeah, so typically we talk about introducing solids at the time you come in for that 4-month visit, knowing that most infants are ready for solids sometime between 4 and 6 months. When we're talking about breastfeeding, that's a time where really they recommend exclusive breastfeeding for that first 6 months of life, so kind of delaying that sort of solids. But there's a window of time, and we're really looking at your baby and their development and their cues for when they're ready. And that's something you can talk to your pediatrician about for when should I start? And then we're more than happy to chat with you about, how to actually go about introducing new foods. So I don't want families who are hearing this and knowing that they're having a hard time finding formula to just feel like, okay, I can substitute with food, because really that food's fun for the first year of life. This isn't, you don't just start solids and now it replaces the calories. We still really need breast milk and formula to meet their nutritional needs as we're teaching them about how delicious sweet potatoes are and how yummy bananas are and all these other things. So it takes some time really for babies to learn how to eat. So that's not going to be a quick fix for anyone looking to kind of replace the shortage here.
Okay, thank you for that. We're getting a lot of questions about expiration dates on formulas. Is it when it hits that date, you need to toss it, or is there a window of time when it is still safe after that use by date to continue using formula? I don't know who wants to answer this one, but feel free to chime in, whoever wants to take it.
I would say, just like any food item, the expiration date is a time that is set by the manufacturer. If it's an open can at the day of the expiration, I think there is a little wiggle room built into all expiration dates. I wouldn't use a can that's maybe 2 years old or 3 years old. Probably doesn't have the bacteria, but probably has gone through its shelf life. So I would treat the formula as a normal food.
Okay, no, that's good to know. Someone asks, is it safe to purchase formula at swap meets? I see Dr. Nelson going,
pondering that one. Thank you for asking. So you'd want to ensure that the can was never opened. We're worried about formula being contaminated. And then there's also a risk, if wherever you're buying your formula, to look at those expiration dates so that someone isn't trying to sell a 2-year expired can at a swap meet just to make money, because families are desperate and looking for it. So really knowing how to read the label, looking at the bottom of the can for the lot number to make sure it's not one that was on the recall list, and looking for that expiration date, as well as looking on the label for how you're supposed to mix that formula. So we want to make sure, going back to that conversation we had about water, that we're following the mixing instructions that come with the formula.
Okay, and Sara, when we were talking about following the directions to a T, the mixing instructions to a T, something that Dr. Shaban had mentioned was that in one of the cases where a child got sick, the bacteria was actually found in something else in the water. So are there any tips you have for parents and caregivers when they're mixing formulas and they're making it? Do you have tips for them to kind of help make it as safe process as possible?
Sure. Definitely make sure your hands are washed when you're the one, if you're the one preparing it. Make sure the bottles are washed well. The nipples for the bottles are also washed well. And then also where you're storing your cans too. So, make sure it's not by something that it can be contaminated. So, we have a lid on it, but that doesn't mean that, something doesn't touch the side of it. We pick up the can, now it's on our hands. So just be really mindful and thoughtful about the placement of anything that your baby's going to touch, not even just food, things that they play with as well.
Okay, no, thank you for that. So Dr. Nelson, in addition to being a complex care pediatrician, is also a board certified lactation consultant. So I'm going to switch gears just a little bit here because there have been some, again, social media. There's been this group of people who are like, formula shortage, well, moms, just breastfeed.
Right.
And helpful for anybody.
That's actually, so making breast milk is a complicated process. So just telling someone to do that or telling someone to do it more. I saw a quote from someone else saying that's like telling a diabetic to just go make their own insulin. Like, well, if you're diabetic, you're going to need insulin and your pancreas just isn't doing it for you. So for moms out there who are nursing and it's going well, fantastic. If you are nursing and you're experiencing a low supply, there are some things that we can do to help you out if you want to regain that supply. So there's some troubleshooting that we can do to really be able to dial in, figure out what's going on, and to be able to help you out. But ultimately, it's supporting families and feeding their babies. And so we really just want families to feel supported. And if you need lactation support as a pediatrician, like, I'm here for you.
No, I think it's so important because I've been even hearing among my own friends about this, how it makes them feel. And some either voluntarily chose to switch to formula right away. And others like me, when my first child was born, had lactose intolerance. And so my lactation consultant said, well, cut out lactose. Lactose is in everything. It's like a binder in hot dogs and, processed foods. And so like I tried, and then it got to the point where it was so hard. Baby was crying all the time. I felt so guilty. And my pediatrician's like, okay, Sara, we're switching to formula. And I'm like, but and she said, no buts, like for you and your family, I want to make sure your child is fed. I want to make sure your sanity is preserved. And Dr. Nelson, there seems to be this culture right now where some people are they're continuing to shame each other. We're like, that's not what we should be doing right now.
No, we don't need judgment right now. We really just need to supply infants with nutrition. But honestly, parenting, we get judged all the time. It constantly is coming at you. Did you do cloth diapers or did you use disposable? How you choose to feed your baby, all the decisions that you make as a parent. And so you as the parent know what's best and what's going to work for you and for your family. And then you work with your doctor when it comes to the nutrition piece if you have questions so that we can help you out.
Thank you for that. Dr. Shaban, what are you getting questions from your children when they come into your patients, when they come into the GI clinic? What are some of the concerns you're seeing, especially because you are a lot of times dealing with children who do have special dietary needs in some cases?
Yeah, so a majority of our patients are patients who require specialized formulas, and our wonderful dietitians and are able to navigate our supply chain to suggest other alternative formulas that are similar in composition for those patients. So we're able to get them on substitutes to the recalled formulas.
Okay, and another question when it comes to mixing, Sara, should you be using purified bottled water or boiled water that has cooled, or is tap water okay when it comes to mixing the formula?
I think that depends on the child's age. And I'm actually going to let Dr. Nelson answer that one because I can't remember off the top of my head what the age group is. But at a certain age, you can switch to regular tap water. It doesn't have to be sterile.
Right. Yeah, so we really want to factor in if your baby was in the NICU, our premature infants, we need to protect them a little bit longer. And so there's that risk of contamination. But for older, healthy children, it's fine to use tap water. The other thing is, for parents, that whether or not you have to heat the bottle and, like what temperature your baby likes to take their bottle. And reality is you can feed them cold bottles. It's fine. If you have a picky baby and they like it warm, that's fine too. But that we've got to be careful once you give the bottle, that once it touches your baby's mouth, we consider it then contaminated. And so from that point, kind of the clock starts for how long that bottle is good for. So if your baby doesn't finish the bottle after 2 hours, the recommendation is the rest of that needs to be thrown out because you have the potential for introducing kind of mouth bacteria into the bottle. And so following some of the food safety guidance is also really important, not only right now, but just in general for how we think about when we're feeding our babies, what we're doing.
So that's a very important point because when you're mixing formula, absent of a shortage, your child has 2 or 3 ounces left in the bottle. You didn't think twice about, okay, I have to toss it. But I can imagine, Dr. Nelson, there might be families out there who are like, wait a minute, there's still 2 ounces left in this. So you're saying after a certain point of time, no, you have to dispose of it.
Right. So after a certain point of time, you're supposed to dispose of it. So the way to get around that and to preserve the formula and breast milk that you have available that you're feeding in a bottle is to actually give a smaller amount at first. That way we're not kind of giving it all to baby at once. So don't make a big 6-ounce bottle if you don't think your baby's that hungry. Or you make the 6 ounces, but pour 3 into a different bottle, feed them the 3 ounces. And then if they're still hungry, give them the other one. And so that way you can kind of keep the formula that you have for as long as you've got without introducing the potential for it again, to get contaminated.
So mixed formula in a different bottle, prepared formula in a different bottle that hasn't touched a baby's mouth can be stored in the fridge longer than
yeah. So, and Sara can answer this too, because there's recipes that families can make, like the picture of some of the formulas. And so you can make your day's amount, keep it safe, and then just pour out the smaller amounts.
Yeah, and it lasts for about 24 hours is what the recommendation is for the refrigerated formula.
Okay. Okay. No, thank you. Someone asked, I am currently combo feeding. What can I do to help increase my milk production just in case I can't find formula?
Right. Okay. So lots of questions about how do I increase it? What do I do? One of the number one things that can decrease milk supply is stress. So the fact that we're worried about
Nelson.
I know. But this is coming, like, I was a breastfeeding mommy too. So acknowledging that it is stressful and that can have an impact with our body's response. Other things that happen to moms too, in terms of like, if mom gets sick, that can impact her supply. Now, things that you can do to help that. Number one is moms, take care of yourself. So you need to be eating and drinking in order to have nutrition for your body, in order to make nutrition for your baby. So please, taking care of yourself as best as you can. And then if you've noticed a decrease in your supply, so if you're pumping and now you're watching those bottles and you're getting less out, there are some other things you can do, such as looking at your pump. There's the little valves that can be replaced, checking the flange. So kind of troubleshooting your setup. After time, some of those parts can actually wear down. And so some simple adjustments there might actually change how much milk you're able to get out for your baby. So if you're in that situation, you're worried about your supply, that's really where your pediatrician and a lactation consultant can kind of run through the big checklist of all the different things that might be, help figure out what it is for you and be able to adjust the situation.
Okay, no, that's great. Thank you. So I think we answered everybody's questions so far. And for those of you who are watching at home, if you continue, if another question pops up in your head, send it to us. And we've got our doctors and Sara here. We will get the answer to you later. We'll also be posting an extensive amount of resources online. Sara and her team had created this great flyer with very useful information about the dietary needs of your child and how to help you navigate this formula shortage. So before we go, I just wanted to just ask you if you had any parting words, Dr. Shaban, not only as a gastroenterologist, but also as a dad of a 14-month-old, I think you said your child is. What's some advice you want to give to those parents watching right now who are understandably pretty worried right now?
Well, I would, highlight what Dr. Nelson, who was actually my son's pediatrician, had mentioned about the breastfeeding. Definitely, moms. I would say if we can decrease the stress, encourage breastfeeding, supplementing with formula, and so on, that would be the best measures. I would like to say that the end is near, hopefully, in the next several weeks. Hopefully the company will start ramping up the formulas according to the note to the providers that I got today. They're going to do Care first and Alimentum, some of the metabolic formulas, and then start doing the Similac or the term baby formulas. So the parents with children with special needs, I think, those will be getting those formulas in first. Pediatric, not only is this affecting infants, it's also affecting older kids who are on Pediatric. Pediatric is also on shortage, and we use that in the kids who require tube feeding. But we have alternatives to that, such as the whole food-based formulas. I think this is a really important time for us as human beings to take a step back and see how the supply shortage and all of that has affected us. But a lot of people who we prescribe formulas for and they get denied by insurance or for other reasons, I think it's important for us all to reflect that there should be equality in a child's ability to get a particular type of formula. I would like to direct patients to a website called nutritionequity.org, where they can share their stories and they can see other kiddos who had similar situations. And these specialized formulas can be very, very expensive, thousands of dollars a month for parents. And so, reaching out to family members that are going through the same process, social media, directing them to stores that contain formulas. I would discourage using Craigslist or Facebook Marketplace for those resorts. And basically, we're in this as a team. Reach out to your providers, reach out to your GI doctors, dietitians, and we can see what we can do to help you guys.
No, and thank you for that important reminder too, Dr. Shaban. Our home care and supply chain teams have also been having to source formulas for older kids, as well as we do have some adult patients too who have these needs. So I'm glad you mentioned that, because you're right, it's affecting a lot of people, but we're certainly trying to help navigate through this. So thank you again for your time and your perspective. Dr. Nelson.
Yeah, just to echo the reach out to your healthcare team aspect of this. If you are having a hard time feeding your baby for whatever reason, talking to your pediatrician is important. We're here to support you, and we might even be able to plug you in with community resources as well. So I know that WIC, not only do they supply formula, but they do have lactation consultants. So there's different people in our community who are there to help you as well. And so we'll, connect you to who we can to get through this together, and just really, being there. And if you're not going through this personally, but you have friends with small children, just reaching out. This is extremely stressful for everyone who has an infant. And so being kind to young parents right now is really important.
Okay, thank you. And Sara, we already have people saying, can you share that information sheet? Yes, we will post this on our website. So for those of you who would like it, we're gonna when everything is up, we are gonna post the links on social media, so you can make sure to have that information, be able to download and print it. We're going to share all of this. We're not going to leave anyone high and dry, and make sure that you all get the information. Sara, before we go, how about some last words from our registered dietitian?
I just want to stress that information that's going to be on that handout. So don't be afraid to use store brand generic formulas. If you're, only using Enfamil or only using Similac, and you've been really true to those brands, go ahead and try other brands. The FDA, every formula has to meet the same standard under the FDA. And a lot of those store brand formulas are being created from similar companies who are creating name brand formulas. So don't be afraid to try those formulas out if that's all that's left on the shelf.
Okay. Parents, though, when we like something and we think our kid likes it, it's hard to switch. But thanks again for that reminder that just because it doesn't have maybe the name on it, it's still just as nutritionally valued. It has the same nutritional values. It still has to adhere to the same guidelines as the other companies. And sometimes it's cheaper too. So no, thank you for all of that. And for those of you watching at home, if you can just do me a favor and just, not spread those theories about here's how to make homemade formula, and instead say, here's where I found some formula, that would be amazing and less stressful and more helpful for everybody. So thank you, Dr. Shaban, Dr. Nelson, Sara, for all of you watching at home. Again, we'll have all these resources up in the comment section and all our social media channels. And as always, if you are in doubt, call your doctor. They are ready to answer. Pediatricians in particular are ready to answer a million questions that you might have. Stay safe, be well, stole your line, Dr. Nelson, and have a great afternoon, everybody.